Now we're going to start the discussion about the breast and the mammary gland. So the mammary gland is nothing but it is the modified sweat gland. It is the modified sweat gland present in the superficial fascia of the pectoral region. Present in superficial fascia of the pectoral region. Okay, right. Now we have one small extension that is called axillary tail of Spence. Now what is axillary tail of Spence and why we have to know about axillary tail of Spence? Axillary tail of Spence is nothing but it is the extension of the breast from the upper and the outer quadrant. So the extension of the upper and the outer quadrant of breast is called axillary tail of Spence. Now why it is called axillary tail? Because which is going to the axilla through one foramen. Which foramen? Foramen of Langer. So axillary tail of Spence reach the axilla through foramen of Langer. Through this foramen of Langer. Okay? Right. Now next one. Now what is the extent of the breast? Now the extent of the breast vertically from second rib to the sixth rib. Second rib to the sixth rib in the midclavicular line. In the midclavicular line. Vertical extension. Second rib to sixth rib. Now horizontally from the lateral border of the sternum to the mid-axillary line. To the mid-axillary line. Along the fourth rib. It is the extent of the breasts. Okay. Vertical extension from second to sixth rib in the midclavicular line and the horizontal extension from the lateral border of sternum to the mid-axillary line. Okay. Right. Now next. What is the relation of the breast and the mammary gland? Now we're going to see the relation superficial to deep. We're going to see the relation from superficial to deep. Okay, I told you mammary gland and the breast present in the superficial fascia of the pectoral region. Yes, deep to the mammary gland, we see the fascia here. What is that? That is our pectoral fascia. Pectoral fascia situated just deep to the breast and the mammary gland. Pectoral fascia will be covering the pectoralis major muscle. And deep to that, you will see the pectoralis major muscle. The breast is also related to this muscle. This is our external oblique muscle. And also this one, that is our serratus anterior muscle. Clear? So the mammary bed, it is formed by three muscles. Pectoralis major muscle, external oblique muscle and serratus anterior muscle. Is it clear? Just deep to the breast and the mammary gland, we have fascia. What fascia? Pectoralis fascia. Pectoral fascia. Right. Now see here. Now see the next diagram. Now this is the breast. Okay. And this is our pectoralis major muscle. And this is the pectoralis fascia covering the pectoralis major muscle. Now, between the gland and the pectoral fascia, we see one space here. Now, this space is called retromammary space. This space is called retromammary space. Name itself, you have a clue. That space is situated behind the breast, behind the mammary gland, and in front of the pectoral fascia. Now, what is present in this spacer? Nothing will be there, which contains only loose areolar tissue. Which contains only the loose areolar tissue. That is why the breast is freely mobile over the pectoral region because of this space only. Okay? Right. Now in the case of carcinoma, the breast will be fixed to the chest wall. Okay? Right. So after the discussion about the retromammary space, now here we are seeing few more parts of the breast. This is nipple and this is the pigmented area that is called areola. Now nipple is nothing but that is the conical projection which is seen at fourth intercostal space in the nulliparous woman. Now, which is supplied by, the nipple is supplied by fourth intercostal nerve. Nipple is supplied by fourth intercostal nerve. And the nipples are pierced by the numerous, see here, nipples are pierced by numerous lactiferous duct. Exactly 15 to 20 lactiferous duct pierce the nipple. 15 to 20, the lactiferous duct pierce the nipple. Now, just beneath the nipple, we see the areola. Now, what is areola? Areola is nothing but, that is the pigmented structure which is seen beneath the nipple. Now, the areola contains modified sebaceous gland. They contain modified sebaceous glands. Now, what these glands will do? They secrete oily secretions. And these oily secretions for lubrication. These oily secretion for the lubrication of the nipple and the areola. Okay. So, this areola secrete, yes, the oily secretions from the modified sebaceous gland, and that is for lubricating the nipple and areola. Okay. Right. Now, see the parenchyma of the mammary gland. Now, the parenchyma of the mammary gland, we have 15 to 20 lobes. These lobes are arranged in radial manner. See here, these are nothing but the lobes. Now, each lobe is divided into so many lobules. Each lobe is divided into so many lobules. So, divided into so many lobules. Then each lobe is drained by, that is our lactiferous duct. Now, this lactiferous duct, before piercing the nipple, which in turn forms one small dilatation, that is called lactiferous sinus. Okay, lactiferous duct dilates to form lactiferous sinus before piercing the nipple. Okay, right. Now, we also see the ligament here. That ligament is called ligament of Cooper. That ligament is called ligament of Cooper. Ligament of Cooper is nothing but, it is a connective tissue which condenses to form. The connective tissue, the condenses to form ligament of Cooper. Now, the ligament of Cooper is extending from skin to the pectoral fascia. The ligament of Cooper extending from the dermis of the skin to pectoral fascia. Okay, that is about the ligament of Cooper. Right? Now, we're going to see the blood supply. Now, what is the blood supply of the mammary gland? Mammary gland is mainly supplied by our internal thoracic artery or internal mammary artery. Internal thoracic artery perforating branches. Internal thoracic artery perforating branches in the second to fourth intercostal space. It is also supplied by our axillary artery. Axillary artery branches except last two. Except last two branches. What are those? The last two branches. The branch from third part. Our anterior, posterior, circumflex humeral. So, except anterior and posterior circumflex humeral. So, except these two arteries, remaining branches of axillary artery will supply. Superior thoracic will supply, lateral thoracic, thoracoacromial, subscapular, all these arteries will supply. And the breast is also supplied by our intercostal arteries. Intercostal arteries. Okay. And the venous drainage is very simple. Veins will follow the arteries. Simple. Now, what is the nerve supply? Nerve supply to the breast is by second to sixth intercostal nerve. Second to sixth intercostal nerve will supply. So next we're going to discuss about the lymphatic drainage of the breast. Lymphatic drainage is very, very important because the carcinoma of breast spreads mainly via lymphatics only. So you have to know about the lymphatic drainage of the breast. Now we are dividing the breast into 4 quadrants: upper lateral, upper medial, lower lateral, lower medial. Now the upper lateral quadrant, the lymphatics will go to the anterior group of axillary nodes. So upper and outer quadrant. Upper and outer quadrant, the lymphatics will go to the anterior group of axillary nodes. Anterior group of axillary nodes. Now upper and medial quadrant. Upper and medial quadrant, lymphatics will go to internal mammary nodes. Internal mammary nodes. Internal mammary nodes of same side but also to the other side. Okay, right. Now lymphatics from lower lateral will go to posterior intercostal nodes. Posterior intercostal nodes. Lymphatics from lower medial will pierce the anterior abdominal wall. Will pierce the anterior abdominal wall and in turn drain to the subperitoneal lymphatic plexus. Lymphatics from lower medial pierce the anterior abdominal wall and in turn drains into subperitoneal lymphatic plexus. This is very, very important, clinically significant. Why, sir? Suppose the patient is having carcinoma in the lower middle quadrant, then the carcinoma will spread to the subperitoneal lymphatic plexus. Now from subperitoneal lymphatic plexus, the carcinoma, which in turn goes to ovary by means of transcelomic spread. Now the carcinoma to the ovary is called Krukenberg's tumors. Is that clear? Right. So carcinoma in the lower medial quadrant of the breast will spread to the ovary. The secondaries will be deposited in the ovary and that is called Krukenberg's tumor of the ovary. Clear? Right. Now, please write one last point. Note. Now, 75% of the lymphatics from the breast will go to the anterior group of axillary nodes. 20% of the lymphatics will go to internal mammary nodes or internal thoracic nodes. 5% will go to, yes, posterior intercostal nodes. 5% will go to posterior intercostal nodes. Just know the percentage. Majority of the lymph nodes first will go to axillary lymph nodes only, anterior axillary nodes. 20% internal mammary, 5% to the post-intercostal nodes. Very few nodes will go to the subperitoneal lymphatic plexus. The carcinoma, if occurring in that region, then the patient will have the carcinoma spread to subperitoneal lymphatic plexus and which in turn spread to the abdominal and the pelvic viscera. Okay, right. That's all about the lymphatic drainage of the breast. And now we are completing the breast and mammary gland module. This is very important topic. Okay, so you may get so many questions, either theory question, also the entrance question from this topic.